Hey girls, Unnie's here! Did you know that the pulse oximeter, the little finger clip that measures oxygen, doesn't work the same for everyone? Studies show it can actually overestimate oxygen levels in Black and Hispanic patients, hiding dangerously low oxygen. Today, we're walking through a paper from JAMA Network Open that asks, does this mistake affect COVID-19 outcomes? Let's dive in. Abstract. Pulse oximeters are essential in COVID-19 care, but they can read higher oxygen levels than reality, especially in people with darker skin tones. This study found that overestimation often led to missed treatment opportunities, delays in medication, and more readmissions. Introduction. Since the 1970s, pulse oximeters have been everywhere, from ICUs to home monitoring kits. Doctors used them during COVID-19 to decide if patients needed oxygen or drugs like remdesivir or steroids. But here's the catch. They're less accurate in patients with more skin pigmentation, which means hidden hypoxemia, real low oxygen that doesn't show up on the screen. This study wanted to see if those errors actually changed outcomes. Methods. Researchers looked at over 24,000 COVID-19 patients in 186 hospitals from 2020 to 2021. Every patient had both a finger pulse oximeter reading, SpO2, and a direct blood oxygen test, CO2. If SpO2 looked fine, say 95%, but the blood test was actually below 94%, that counted as a missed need for treatment. Then they checked. Did those patients get delayed care? Did they die more often? Or did they come back to the hospital? Results. Black patients' readings were, on average, almost 1% higher than their real blood oxygen. For Hispanic and other minority patients, the difference was smaller but still significant. Hidden hypoxemia happened in about 18 to 21% of Black and Hispanic patients, compared to 13% in white patients. When treatment need was missed, patients got their COVID meds about an hour later and were 10% less likely to receive treatment at all. Most striking, these patients were 2.4 times more likely to be readmitted within 30 days. Interestingly, the error didn't clearly change hospital death rates, but it did delay care and increase the revolving door of readmissions. Discussion. So what does this mean? Pulse oximeters tend to overestimate oxygen across all groups, but the bias shows up more often in patients with darker skin. That overestimation leads to unrecognized hypoxemia, which delays COVID treatment and increases readmissions. The problem isn't race itself, it's the device. That lost time matters. But because minorities are disproportionately affected, this device bias magnifies existing health inequalities. Conclusion. The key point: pulse oximeters tend to overestimate oxygen in patients with darker skin, leading to missed needs and delayed care. This small flaw highlights why medicine needs more accurate, fair technology. And that's it for today's paper. Thanks for reading through this research with me. See you next time.